So welcome back and to this presentation today. And we have two distinguished personalities, people of prominence, eminent citizens of Liberia. Of course, in persons of Dr. Professor Peter S. Comer. He's the second vice president and chairperson of the 2025 Annual General and Scientific Meeting, the Liberia College of Physicians and surgeons. Of course, they are right here with us, including Dr. Federa E. Bright. He's the Secretary General of the Liberia College of Physicians and Surgeons of the Republic of Liberia. We want to say, Angel, these are brains that we have with us today.
And we are honored to have them here this morning. And they are set this morning to educate the public on the Liberia College of Physicians and Surgeons workings, and also we'll be talking about infection control during surgery. So at this juncture, we will join our guests and to introduce themselves this morning, beginning with Dr. Comer. Professor Comer, good morning. Welcome to the program.
Good morning, Angie. Good morning, Stuart. And it is a pleasure to be back in your beautiful studio. And I must admit, anytime I come here, it's more enforced, and I'm very proud of the work you guys do here.
Thank you.
Well, I'm Professor Peter S. Coleman, second vice president of the Liberia College of Physicians and Surgeons. And the college is established as the name depicts, College of Physicians and Surgeons. So surgeons and physicians.
Okay, these are two words we have to.
Yeah, definitely. Surgeons are those that do the cutting, the general surgeons.
That you will come to that, but please, because it takes a time for people of prominence, for your citizens to know whether you people are still around the terrain. So just talk a bit about yourself. Who is Dr. Peter S. Comer?
Well, Dr. Comer name has been around for some time now. Well, as I stated, I am the professor or second vice president at the College of Physicians and Surgeons. Before coming to this position, you know, I was senator for Grand Crew County, head of gender and health at the Senate for almost 9 years.
Okay.
And before that, I was Minister of Health of the Republic of Liberia from 1998 to 2006. So basically, I've been around for a long time, and it is a pleasure really being here.
And you still look young. I recall when I was in Lokiri Baptist Mission, I used to pass by a house coming from Virginia, going across the road there, and you still look that young.
Nothing has
Well,
changed.
thank you, Melvin. It means that the good Lord has been good to me, and maybe most likely my lifestyle. But yeah, so that's one of the reasons I'm still around.
Oh, okay, that's good. Let's hear from
Let's hear from you.
Thank you, Angie and team. I'm Dr. Federa E. Bright. I'm the Secretary General of the Liberia College of Physicians and Surgeons. For me, I've worked with the UNFPA as assistant rep for the past 13 years before joining the LCPS.
Okay. So, Melvin, we can just run straight into our discussion, right?
Yeah.
So we are discussing the Liberia College of Physicians and Surgeons today. But I want us to first establish what exactly the Liberia College of Physicians and Surgeons is.
Well, thank you, Andy. The Liberia College of Physicians and Surgeons was established through an act of the National Legislature in 2013, and I'm proud to say in 2013 I championed that legislation.
Okay.
The basis of it was that in our country at that time we had less than 15 specialists in the entire country. Just imagine a population of almost 5 million with less than 15 specialists. So that would mean if you put that proportion, it's about 150,000 persons to one, and there were very few of us. So what that did, it necessitated the need to start training our own specialists. Every country goes through that. So we work together as those of us who were on the ground, passed the legislation, and quickly it was approved. It was by the legislature, was passed by the legislature, and the college was established in 2013. Since that time, so what is the college? Okay, I think it's important to stress that. The college comprises two groups of doctors. A group of doctors that are physicians. For example, Dr. Pratt here is a physician. He's not a surgeon. I am a surgeon. Okay, so surgeons are those that we will do intervention on the body, like general surgeons, eye, people that operate on the eye, gynecologists, these groups of people are people that intervene physically on the body, as compared to the physicians are those that do no intervention, in a sense that they don't cut the body, but they also provide health and services. These are the pediatricians, the internists, the public health physicians, those that investigate epidemics and other things. So there are two categories all around the world is like that. So that's the reason why it's called College of Physicians and Surgeons. If you go to Ghana, it's almost the same configuration. In Nigeria, it's almost the same for configuration. So we established that college, and from less than 15 specialists in 2013, by today, we have graduated almost 143 specialists, you can imagine. So there's a lot of work that has been done over the last, for example, we have pretty close to 45 gynecologists now.
In Liberia?
Yes, trained, that are working in different parts of the country. We have pretty close to 39 surgeons that, just imagine, at that time in 2013, there were about 3 or 4 of us surgeons, and all of us were in Monrovia. So now we have about almost 40 surgeons. You can find them in Ganta, you can find them in Maryland, you can find all over.
All trained by the school.
Oh, they're definitely trained by the school. Besides that, we have trained pediatricians. These are that group of doctors that treat children. We have trained internists. We have trained community health specialists. Initially, the college had the basic faculty, that was pediatrics, general surgery, general surgery, obstetrics and gynecology, and internal medicine. Then we added other faculties, ophthalmology. We added family medicine. These are physicians that basically treat people at home. Okay, they are in the community, people have easy access to them. Then we added psychiatry. So up to now, I think we've been able to train about 3 or 4 locally trained psychiatrists, okay, that are working in our services. Of recent, we have added anesthesiology and radiology, okay. These are very rare, scarce manpower all around the world, not only talking about sub-Saharan Africa. We have very few radiologists. We have very few anesthesiologists.
Professor Coleman, do we have, a way that you can break down some of those terms for, our old lady in that village that listening, when we say the gynecologist, what is it that they do? We would say, Melvin,
Yeah.
or some of them to understand. So
Okay,
that
I'm
they-
sure as the discussion goes,
Yeah.
we'll gradually break them down. I've been trying.
Yeah.
I've been
I
trying to
understand.
do it.
But,
Notice that.
yeah, but Professor Comer, we would like you to tell us how you go about with these training exercises, how students enroll, and what are the grace period for graduation, and what qualifies them to become operational in those areas.
Okay, now, so like I said, at the college we have different faculties. So the faculties of general surgery that trains. So normally to enter the LCPS, you must first have your first medical degree as a doctor.
Okay.
So you are coming in now to do postgraduate studies. You are coming to specialize. You are coming to specialize in different fields. So you must have that first degree, and most times in cooperation with the ministry, a young doctor graduates from AMW College of Medicine. He goes out, perform 2 years of rural services. After that, he gets qualified and he applies. He has to take an examination to be able to enter. Not everybody that takes an examination passes, you know that. Okay, so it's a restricted number, and all our colleges, all our faculties duration is a period of 3 years.
Okay.
3 years, and what happens is that the movement from 1 year to another, you must pass an examination.
Is that a state board? Is that a state
No,
board?
that's not a state board.
Okay.
So it's a training institution. So for you to make progress from one phase to the other, you must pass a promotional exam, and then to exit as a specialist, you have to take a final exam. So it's a very tough training program, that a very rigorous one, and that training is that you are working at the hospital, you are taking calls for those who doing surgery. You got to go into surgery. Those that are doing internal medicine basically got to see patients in OPD. So it's intensive. It's a lot of work. But let me pass it on to the Secretary General to throw more light on that.
Oh.
Okay.
Thank you, Prof. As Prof said, this training is organized in a way that it goes for a period of 3 years, post undergraduate medical degree, and then after that, you go through this rigorous training in a training teaching hospital. All right. Now there are regulations that are followed, and we follow the curriculum that the West African College of Physicians has and the West African College of Surgery has, meaning that whatever is being taught here is similar to what is taught in Nigeria, similar to what is taught in Sierra Leone, similar to what is taught in Ghana, etc. So that, and then when you train at the end before you take your exit, at times we bring in professors from outside, from other colleges, to come and sit on the panel to examine our graduates. And once you pass that exam, then we graduate you to be deployed by the Ministry of Health. But it's important that you must, pass that final exam before you are graduated.
So, Dr. Park, how is this college different from other medical schools? Like, what's the big about it?
Well, yeah, in a country, you have a disease condition that is unique to a particular environment. So for Liberia, I would say those that are trained within the college have expertise in dealing with disease condition or disease burden that are within our environment. For instance, doctors that have been trained in Liberia have very good or very vast experience when it comes to dealing with infectious diseases, referencing the Ebola, referencing the COVID, And that experience of people from other countries who are trained elsewhere are very anxious to, to learn from what we've experienced over the years. So that's why we have a lot of collaboration with other colleges to ensure that we can share knowledge around these kind of conditions. And when we send our residents out, they also go and learn similarly from other regions to have a much vast knowledge in that area, and they come back to provide those services.
Let me throw some light on that.
Okay.
So, like I said, in training in medicine, we have the undergraduate degree that the University of Liberia provides through the AMWT College of Medicine. So that's the undergraduate degree. After the undergraduate, after you get your degree as a doctor, you go out and do some rural services. Then you come back and apply for postgraduate training. That's the training that makes you a specialist. Okay, so every young doctor that graduates from medical school has his passion, or which area he wants to go
what they
to,
want to specialize.
what they want to specialize in. So that's the normal hierarchy of medicine all around the world. Postgraduate training helps to provide these highly trained people that can perform extra services, for the population. And it took Liberia some time to make that move. But since we've made that move, right now, if you go to Bonny, at the Bonny Hospital, you'll find a gynecologist there, the one that deliver women, and do a woman needs to operation that can take out the baby from the woman's stomach and all these sort of things. You'll find a pediatrician, the doctor that is able to take care of all children illnesses. You'll find internist, the one that treat heart disease, blood pressure, high blood pressure, and all this malaria and other things. And you'll find specialists in Bonny, you'll find specialists in Bopulu, you'll find specialists in Banga, you'll find specialists in Maryland, you'll find specialists in Buchanan. Since we established this college, because of that, when some of us were very small, you were not born at that time, they used to bring foreign people to this country to take care of our people. Now we don't have to do it because we are training our own specialists. Okay? And that's a milestone for our country. It has put healthcare to another level. Okay? Right now, if there is a mass casualty and at the JFK, we have locally trained surgeons that are qualified enough to deal with we have bone doctors, we have neurosurgeons, we have ear, nose, and throat people. So our health system has evolved over the last 10 to 15 years, and you can see many things that people used to fly to Ghana, to India for, a lot of right here by you at Jamali, in terms of the imaging and other things, all these things are now done in our country. So that's the reason why, for example, now we are training radiologists. So we don't have to bring in foreign people to read the X-ray, to read the MRI, to read the CAT scan. We are trying our best to strengthen our health system.
I know, Dr. Como, you or Professor Como, you won't want your efforts to be dashed down in the dust or in the mud. And so when you train these persons, these personalities, you would need some good results from their operations. After the training exercise, after their schooling processes, when they go to the field, when they go back to those institutions, do you do follow-up to ensure that they have equipment to work with? Because you have the brains, but you don't have the equipment for the brains to operate on.
Definitely. That's why it's a close collaboration between the Ministry of Health and the LCPS. We do the training, they equip the hospitals. We train the human resource personnel and then it's their mandate to equip the hospitals. For example, quite recently, Dr. Poto, I mean, she's doing excellently well. I mean, now you got ultrasound machines, you got all the laboratories have been upgraded, X-ray machines. So if you go to all these hospitals I'm talking about, when I was minister, these things, we didn't have those facilities. Now we have them. You know, we have them, but we also have personnel, trained personnel to man these things. You know, that's what I say. It has taken healthcare in this country to another level.
Yeah, so you mentioned close collaboration, which also concern about partnerships. What other international partnerships do we have as well?
Well, we're doing a lot of collaboration with our international partners. For example, like now, at this 9th, since you haven't gone into that topic, let me just jump quickly into it. At this convocation program that we are hosting this week, where we'll be graduating about 13 new specialists. It's we collaborate with a lot of partners. For example, in the different faculties, for example, in surgery, there's a collaboration with the Dutch Surgical Society they are personally here because after the convocation, we are going with some of the residents that we are training to Phoebe Hospital to perform free surgery for the people of Bond County, especially as it relates to the big neck thing, goiter.
Yeah.
Okay, so next week we'll be there for 5 days training our young doctors to perform this surgery.
In Phoebe and Phoebe Doma.
At Phoebe Hospital.
Phoebe Hospital.
Yeah, I mean, but basically it's for central Liberia, so patients are coming from Nimba, from Lofa and other places, okay? But that's just to signify the collaboration. But there's a lot of collaboration we have with different universities in the States and around the world. Besides that, the collaboration with the West African Health Organization, both the West African College of Physicians, which Dr. Pratt is a fellow, the West African College of Surgeons, which I am a fellow, they are Liberian fellows. So what happens is that whenever we have examination, especially final examination for these graduates, we bring in these specialists from out to reduce the biasness, okay, that we sit at the examination table to screen these graduates, okay, these external examiners. And it is important that we do it because we are part of the West African organization. We have a similar system in our sub-region. So it has to be in line with that. So it doesn't appear that all the Liberian people put people together, the training, they say this and that. There are specific guidelines, specific the curriculum that must be followed, and that's how we do it.
Let's hear you on that. You want to add to what Dr. Coleman just said?
Well, if I may add, I think it's important that we standardize training across the region. That's why we have these cross-examination. We want to ensure that if a physician or a surgeon is trained in Liberia, he is equally, capable of practicing in any country in the sub-region and even beyond. So that's why we partner with, we have these strong partnerships to ensure that our graduates are on par with others around the world.
So, Professor Coleman, you have more to talk about the upcoming graduation. Can you just dive into that?
Well, so this week, it's graduation week. Specifically on Thursday and Friday, we will be holding our annual general and scientific meeting, and it will be culminated into the final graduation of 12 graduates that have finished their studies. So we'll be graduating 12 new specialists for Liberia. On Thursday, we have different presentations because this is one of the criteria in postgraduate training. You must be able to do research. You must be able to make presentation to the public and to the scientific community of what research you've done. So a lot of our graduates will be making presentations. There will be presentations in general surgery, presentations in community medicine, looking at epidemics, researching diseases, what's happening, for example, the issue of what's happening with mpox, the issue of
the flu,
some flu now that
that's influenza.
Yeah. Okay. So, and the good thing about the LCPS is that we provide these specialists to go and research these things. Like that. Liberia is a member of the scientific community. We have a voice when it comes to making research, doing publications. And that's one of the guidelines that these people who undergo the training must. So on Thursday we're going to have a whole day of presentations. Scientific presentations. We'll be discussing so many issues, and we hope that LBS will be there, to carry some of these things live, so people get to know what is happening. Yes, medicine, it's a lot of things happens in the hospital, but you also have to look at your data. You got to research yourself, whether what you are doing is right, or whether your results are similar to other people in other areas. Okay, so those are the kind of comparative analysis and things that are done in that setting. On Friday is the big day, or the Speaker of the House is going to be our guest speaker at that program. We will be, sometime last year we inducted President Boakai as an honorary fellow of this college. Okay, so this year we will be having some other designation of other people that have worked in the health sector. Okay, and so there's going to be a lot of fanfare, especially people after 3 tense years. Some of them, not only 3 years, some of them 4 or 5 years, some of them failed, and they had to repeat.
And some of them will be graduating now.
Some of them will be graduating, Some of them will be graduating in 3 years, some of them will be graduating in 5 years, I've used 5 years, but it's intensive, okay? But at the end of the day, graduation is always a time of fanfare, happiness, so a lot of the relatives are going to be there, to wish goodwill to the graduates.
Has the speaker consented to serve as guest speaker?
Definitely.
And I know you at the college, at your institution, you have some challenges, even though, yes, there is no institution that does exist without challenges. If you would just speak about a few of them, and I know they will be preferred to the speaker on that occasion.
Yes, definitely. At TC is like, this is a college in 2013 when it started, had only 4 faculties. Now we have moved now to 10 faculties. So one thing is starting a faculty, and when you start something new, there's always the financial component of it. And a lot hasn't changed in the budget since 2013. Okay, so we will be talking with him, but we've already started negotiation with authorities and Ministry of Finance, because as the college gets bigger, so with the funding, more doctors will apply, or more specialists are going to be produced. So definitely there is a need to augment the amount of money. The amount of money that was available in 2013 cannot be the same amount of money in 2025. You have 4 faculties, now you got pretty close to 10. Definitely there has to be some arrangements, and we're in the process of doing that.
All right.
But if I may just add,
yes, sir.
Because it's also very important as we look at the longevity of the college. We've got to look at the issue of sustainability, and we worked around that. So we have been training Liberian doctors outside of the country as well to train and come back in country to support our institutions. So as we, from its infancy stage, we had a lot of expats, foreign doctors in country, but now we have gradually been able to wean out, those foreign doctors and now take in a lot of locally produced or Liberians, that studied abroad. So over time, I think we have a schedule, a plan, and we have even been in discussion with CSA Boss on these issues, so that with time, we're looking to talk about between 3 to 5 years, we're going to have just about all of our faculty chairs being Liberians. And that helped with the wage bill, because it will reduce the wage bill because you pay less
for your own people.
Yes.
Yeah. Then bring in foreigners.
Right. So we are looking at all of that as a means of sustainability.
All right, good. And I see a lot of work being done by you people at the college. But let's just look at something quickly before we open the lines. I will read something coming from the Minister of Health very shortly. But let's address this right now, the infection control during surgery. Let's just look at that. When people hear about infection control during surgery, they get confused. What is it all about?
Well, thank you, Melvin. One of the things that retarded mankind in doing surgery was the issue of infection. Okay, sometimes around 1860, before, I think you heard of some guy they call Louis Pasteur, microbiologist. He discovered bacteria. That's when the whole thing started. Before then, you can imagine people used to just do operation, and they had no data, no information as to what were causing people to die. So you can imagine what happened before that era. So since the time of Pasteur, things have evolved. People now, before then, people just used to take gloves, cut somebody and try to help. But now you don't take any type of glove. Those gloves need to be sterilized. Okay, sterilized means that no bacteria. We heat it up. We boil our instruments. We make sure that the clothes you wear when you enter the operating room is not the clothes that you wear from outside. Okay, even at that, when you enter the rear operating room, the things that we put on you are practically sterilized. There are no bacteria, no viruses, no fungi. Viruses, bacteria, fungi are things that cause diseases. So once you sterilize these things, okay, you are sure that you have a safe environment. Now, in surgery, infection control is not only for surgery, but infection control generally in the hospital. That's the reason why hospitals have to be clean 4, 5, 6 times a day. Okay, infection control is important. If you don't attach importance to that, you will transmit infection from out into the patient. Somebody that comes with acute appendicitis, that appendix has already ruptured, it's already infection in the person's body. Your duty is to remove it, but in that process, you are not going to introduce others, because that will kill the patient quicker. Okay, so in surgery, the important thing is first to make sure that nobody comes into the operating room with street clothes. There are limits. There are limits to where you can reach. And you get in the theater, you're going to be dressed, you're going to put on sterile gloves, everything going to be clean, and you're going to remain that way. So there is a code of conduct in the operating room that reduces the possibility of spread of infection. if I'm going to put a tube in you, that tube is sterile. How I touch it must continue to be sterile. I have to do it in such a way that it remains, like I said, to do no harm. That's one of the most important things about medicine. Okay, so since that time, since the days of Pasteur and other things, a lot have changed in medicine, and especially in surgery. You know, before you open up a human being, you got to make sure you have an environment that is clear of any of these organisms, like what we call the bacteria, the viruses, and other things. Okay, so once you do that, under those conditions, you are sure that
you have a safe
environment. I mean, safe from infection, and that will help for quicker recovery of the patient.
Well, Professor Coleman, you talk more about the doctors. How can patients help as well to prevent infection during surgery?
Well, okay. For example, in surgery, you have two types of surgery: emergency and elective. Those ones that come as emergency, and those other ones that you can plan. Okay. For the emergency one, I won't talk, because whether I like it or not, emergency, I have to intervene.
Okay.
But for those ones that I have to plan, we got to make sure that they are all right. You know, we got to take care of all the different types of infection before you carry these people to the operating room. So, for example, somebody that comes in has upper respiratory tract infection, nose running, you know, and this patient needs to remove a goiter, okay, or has a lump somewhere. That is not an emergency. So I will treat those infections, give instruction to the patients. This is what you do. This is what you shouldn't do. You know, and when that infection is cleared, then you can program the patient for that planned surgery. But like I said, it's different when it comes to emergency. If the appendix is ruptured, whether you like it or not, you know, you got to go in there, remove that appendix, remove that infection. That's a different scenario. But patients in surgery, patients need to be prepared very well. That's one of the reasons, for example, planned surgery, you don't keep a patient long in the hospital. The patient comes from whom you've treated them already. They come from whom in the evening, they are admitted. The next morning, surgery is performed. Right after that, they go home. Okay, because what happens too, there's other possibility of what we call in-hospital infection. This is what we call nosocomial infection. The longer a patient stays in a hospital, you know, the higher the possibility
of contracting more.
Okay, so all of these things, all of these factors are the things we'll be talking about that will help reduce infection. Infection is the greatest fear when it comes to surgery. Okay, and when you open up a body tissue, the human body, the body doesn't have an infection there. You got to make sure you don't introduce it. You got to make sure, for example, for me as a surgeon, if my nose is running and I'm coughing, I'm not fit to go into that operating room. I'm not fit to perform that surgery.
Because you are the only person on ground.
What I not talking most likely you have to double the mask, you know. But thank God, Liberia has moved from that stage that people like me would not be. What 10, 15 years ago it was. Now, by virtue of what LCPS and others have done, we have far more people to do it. You know, you can adhere to those principles.
All right, let's read this information. Maybe then we can take a few calls.
Sure.
Yeah.
Go ahead, Melvin.
The Ministry of Health informs the general public of an increase in seasonal flu cases nationwide, with Montserrat County reporting the highest number. Common symptoms include fever, cough, runny nose, sneezing, sore throat, headache, body ache, and fatigue. High-risk groups: children and students, elderly persons, pregnant women, individuals with chronic illnesses such as asthma, diabetes, or heart disease. Preventive actions: seek medical attention if you develop these flu-like symptoms and wear a mask when around others. Stay home when sick to prevent transmission. Wash hands regularly with soap and clean water. Cover your mouth and nose when coughing or sneezing. Disinfect frequently touched surfaces. Avoid crowded and poorly ventilated areas. Government response: enhanced surveillance in health facilities, public awareness campaigns in communities and through the media, collaboration with the Ministry of Education to strengthen health measures in schools. The Ministry of Health assures the public that effective measures are being implemented and encourages everyone to adhere to these preventive actions to protect themselves, their families, and their communities. Dr. Catherine Thomas Cooper, Chief Medical Officer of the Republic of Liberia, signed this notice, this citation. So, Angel, yeah.
And Dr. Coleman, Professor Coleman, mentioned that our specialists will also be doing research so that we can look into that as well. Well, if you just join us, you are listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. And we talked this morning with Professor Coleman and Dr. Part. They have been talking more on infection control during surgery and the role of postgraduate medical education in Liberia. To be a part of this conversation, you can call us on 0880-514-096, 0880-514-096, or 0775-677-376, 0775-677-376 are the numbers to call. Call us this morning and be a part of this conversation. We have our first caller, Nevin. Good morning. Fine, your name and where do you join us from?
Thank you. Your name is Clever, and I joined from with my friend. The issue I listened to it myself, let me first say, what's the extent and thanks to them first for this to educate people, and most of this was, I think there was one putting, I took over original election, but everything was going smooth. Or sometimes I still feeling a little bit painful. So I want to know what's the solution for that.
Thank you so much. Yeah, more calls can come in 0880-514-096, 0880-514-096, 0775-677376, 0775-677376. Are the numbers you call and be part of the conversation this morning. We have two health professionals here in studio. Let's hear from this person. Inja. Good morning.
Good morning. Is this ELBC?
Yes, sir. No time, Chief. Please go ahead quickly.
Thank you so much. My name is BAC Sewon, a medical doctor, and I just called to commend my professors in studio in person of Professor Kumo and Professor Pratt. In the last decade or so, the LCPS has been a bedrock, for recent healthcare delivery in Liberia. And as such, with the program upcoming, I just want to join their voices to encourage medical education in Liberia, especially under the theme infection prevention and control. As part of ways of preventing infection, as my esteemed professor mentioned there, one of it is there's a patient and caregiver factor. Don't forget that as we go in and out day by day to visit our patients at the various health facilities, for instance, we go and then what we carry with us, we touch patient wounds, sit on patient beds, and so forth. Sometimes we take these organisms from out and bring it to the hospital, and after doing a decent job as healthcare practitioners, we still introduce infections as caregivers on these patients. And so one way we can also prevent it is that as we go day by day to visit our relatives who are in hospital, who are going to go surgery and so forth, let us make sure to adhere to the infection prevention and control methods. But not touching the wounds of the patient, their beds, and so forth.
Okay.
Thank you. Angel, speak to this person.
Good morning.
Good morning.
Your name and where do you join us from?
Thanks for the opportunity. I did join the show this morning from my office in Congo. My name is Mamadou Barry, and I listened to your studio guests. They have presented very well, and I think it is a program that we all need to take advantage of. It is a privilege for incoming doctors that they on the school level to take advantage of, because what they have explained, it has inspired me a lot, and I will encourage our medical students who are at the rural colleges in the country to take advantage of this opportunity. So I just want to say hats up to them, and thanks for the opportunity.
Let's talk to this last person, Angel, so we'll go to the guest.
Good morning.
Yeah, good morning.
Your name and where do you join us from?
Okay, I'm Jalen coming from Ghana.
Go ahead.
Yeah, what is Dr. Kuma that where if the operation there is something getting big painful, looking heavy, the waiting is occurring.
All right, thank you. Yeah, so Angel, let's hear from the guest quickly because we are running out of time.
Professor Kuma?
Yeah.
Dr. Pratt, you start?
Well, most of the questions were basically on
Dr.
surgery.
Yeah.
So
Okay, so Professor Kuma.
Yeah, okay. I think there was the first caller that talked about we had some operation in 2014. He's still not feeling well. I think one of the first things he has to do, first go to the hospital where the surgery was done. If that doctor is no more around, then you can come to us at the JFK. We have different classes of surgeons that can look at you, that can deal with your problems. We have different means to investigate the cause of your pain. We have different imaging procedures that we can use. I always make this comparison. 15 years ago, we didn't have it. So now the possibility is so enormous that somebody that has surgery shouldn't be sitting down there complaining about pain, and cannot be helped. Okay. I think the second caller too talk about the same thing. He's having pain. The problem with most of our people after surgery, they disappear from follow-up because we would like these patients to come back first after surgery. The first 1 or 2 weeks you come back. Normally what happens is that when everything is fine, they just disappear. And the good thing is that we would like to keep our contact with them. Whether you are feeling fine or not feeling fine, at least come to your doctor, have a conversation, or right now it's easier, telephone call, to say, oh look, this is happening, that is happening, and follow up. People must always, even if you are feeling well, you must do some follow-up.
So that just finally, just give your party comments, just maybe 30 seconds, then we'll go to Dr. Pratt.
Yeah, okay. So first of all, I just like to encourage the public to kindly partake in the festivities on Thursday and Friday at the EJS Ministerial Complex. It's going to be very interesting times. We especially like our medical students and students in high school that are interested in the sciences. Come and participate. See what it looks like with medicine at the highest level. People discussing issues. You can meet big professors. There will be a lot of foreign professors that can guide you if you want to go into the medical field. Okay, so we like to encourage the public to kindly participate.
Thank you. Dr. Pratt, quickly.
Yeah, thank you. I think one of the takeaway I would like for our guests our listeners to get out there. When it comes to infection, your personal hygiene is primary. It's one of the most important things. But so with that team, we're just admonishing the general public to make use of the postgraduate medical education in this country and use the best you can. Go to our hospitals because we got trained specialists to take care of you.
Okay.
Well, it was actually good having you people this morning. We wish you all the best.
Thank you. Thank you, Evan. Thank you.
Well, they've been our guest on Roadway to Health, Professor Peter S. Coleman. He's the second Vice President and Chairperson of the 2025 Annual General and Scientific Meeting at the Liberia College of Physicians and Surgeons, and Dr. Federa E. Pride is the Secretary General of the Liberia College of Physicians and Surgeons. They've been our guest on this edition of the program Roadway to Health. Thanks to all of you for listening, and thanks to the Communications Division at the Ministry of Health and our humble minister, Dr. Louis Maple Otto, for giving us this opportunity to always inform our people on this platform. Inja and Augusti Gaima, thanks for carrying us live across the world on the Ministry of Health social media handle. My name is Melvin Stewart, and
Angela Noah.